Hey everybody, Ingra Spark here from Southbridge Street Live, and I just wanted to let you guys know that we have banded together with CASA, Golden Crescent CASA of Victoria, for their annual backpack drive. Now I know it's summertime, so this is a crazy time to be thinking about school, but for organizations like CASA, they need to gather materials and supplies for children all year long. So this is it for the next couple of weeks. On Southbridge Live, you're going to see that some of my guests will be bringing in backpacks themselves. If you also would like to donate a backpack or school supplies, you can come by our studio at 1102 North William Street, or you can call me at 361-649-1825, and I'll be happy to come by, pick up backpacks and supplies to help support our local Golden Crescent CASA. Happy Thursday, everybody, and welcome to another edition of Southbridge Street Live. It is my absolute honor to introduce my next guest. This is Dr. Micheal Mcleod, and you're from the Victoria Family Medical Center. And you're here today to talk about something that I am fascinated with, which is direct primary care. So, welcome to the show, sir.
Thank you. It's good to be here.
Yeah, absolutely. So I was reading on your website some frequently asked questions, but I was really, what struck me was that you actually have been in our area for the last 20 years. Right. And so were you, I don't know what to say. Do I even say, were you just a regular doctor in a medical, a medical office?
I spent from 1999 on, just right after my training in Cuero, and for about 18 years I was a traditional family medicine doctor, did just about everything.
Yes.
Delivered babies, worked in nursing home, hospital, ICU, kitchen table.
Right.
Pretty much wherever patients found me.
Yes, absolutely. So what is the definition of direct primary care?
Well, it's basically based on the concept that the fundamental relationship in medicine should be between a patient and a doctor. And it's kind of gotten lost in the business of medicine in the past 20, 30 years.
Oh, absolutely.
So there's a huge movement in medicine right now of basically burnout in physicians that are just having a really difficult time dealing with the regulations and insurance companies and governmental programs. And when you boil the relationship of medicine back down to the physician and the patient, that's sort of where the magic happens. That's where the healing happens. And the farther we get away from that with the business of medicine, the more inefficient the medical system works.
Right. So in this particular way to see patients, what's different about it is that third party, it has been eliminated, that it's just a direct connection between the doctor and the patient.
Right.
And then therefore things like insurance outside of Medicare is not accepted.
Right. Many of our patients actually have traditional insurance,
right.
but many of them have high deductible policies where their out-of-pocket expenses are, well, let's just say exorbitant.
Right.
They pay the insurance company a lot, and then they pay their doctors a lot and co-pays for procedures and things. What our clinic does is basically boil down the primary care relationship to a monthly fee, and that membership entitles them access to me and the clinic pretty much 24/7.
I saw that, yeah, 24/7, yeah.
So when we get outside of the relationship of the insurance companies and we're no longer documenting things to please Medicare and insurance and things like that, we wind up able to take care of patients, and we also are able to use technology in ways that we can't with other modalities. For example, our patients text us more than they call us now. That's something that is traditionally not a reimbursable service, so most physicians won't be texting back and forth with their patients. But when we do it through our secure app, we're able to cover a lot of ground and take care of a lot of problems without having a patient have to come into the clinic every time just so they can generate another charge for an insurance company.
Right. So if you have insurance, what is the benefit of having insurance but then also having a membership?
Well, like I say, insurance is really good, and it's really designed for catastrophic events. It's geared towards saving us when we have a hospitalization or a surgery or something unexpected. But primary care has never really been very well reimbursed for insurance, and we liken it to if every time you went to get your oil changed, you had to get it pre-authorized with your automobile insurance company. It wouldn't be an efficient process. And we feel like that when we take the barriers away from primary care, that patients are able to access us more frequently. They're able to take care of preventative medicine and stay healthier. And then when they do get sick, they're able to get to us much more quickly than they would in a traditional practice.
How so?
Well, not only do we have access through texting and sometimes through emails and calling, and all of that goes through the weekend. And as opposed to other practices where there may be other providers and practice extenders, they call nurse practitioners and physician assistants. In our practice, it's just me. So pretty much the phone rings to me 24/7. And patients are very respectful. They don't call and ask for refills at midnight on Saturday. But if they do have something that comes up, we're usually able to address it. And even if they have to go someplace, we can direct them to the most efficient place. Our memberships are basically priced so low that if we save them one trip to urgent care per year, that's worth probably 6 months worth of membership fees.
Right.
If you save somebody a trip to the ER, that more than pays for a year's membership.
Now, are you sort of spearheading this movement in Victoria, or are there other direct primary care physicians?
It's a really exciting movement nationwide. We have somewhere over 1,000 practices doing this, and it's doubling every year. More and more physicians are stepping out of a traditional practice where they're burning out and connecting directly with patients, and it's something that hasn't happened below I-10 yet, and so ours is the first practice to kind of do that.
Wow.
But I anticipate there'll be other physicians that follow, because it's like I say, for physicians, it's a win situation. Most physicians who do this have a smile on their face because they're back connected with their patients. They're having longer appointments. They're able to address all their patients' needs. And for patients, it's much better because they have a direct personal relationship with the physician again.
Can I ask you something kind of personal, which is, for a doctor, I would assume, or for myself personally, seeing 3,000 patients in a year is lovely, or meeting 3,000 people is lovely, but to be able to really connect to 1,000 of them truly, and doesn't this type of primary care eliminate or somehow filter so that you have a smaller base of patients, but you have just a deeper connection with them? Is that correct? Because that's
it's basically the argument of quality over quantity.
Right.
And when you operate a practice in a low overhead business model, you're able to see patients not only for less, but you're also able to see them for longer.
Right.
And that relationship becomes deeper, and really only through that extra time you have with patients can you really figure out what it is that's going to heal them. It's usually not a prescription. It's usually not just another drug or something. And unfortunately, that's what medicine has become. You go into the office in a traditional practice, the purpose of the office in some sense is to get you out as quick as we can because we've got 35 other patients to see. And in this practice, it's just not that way. We're not rushing anybody. Patients wait 5 minutes to see me for an hour instead of waiting an hour to see me for 5 minutes like they did before.
How long did it take for you to make that transition?
Well, the transition is a gradual process, and most people who have started this kind of practice will find that it takes about 1.5 years to hit your peak, and we're only 6 months in. Having said that, our patient panel is about half full right now, and I'm as busy as I need to be right now. So when you bring new patients in, it takes extra time to get to know them, especially if you've never met them before, and so each patient as they come in has that extra time, and for us that allows them to respond after hours or times when they need extra help because we already know them.
So you are taking new patients at this time?
Yeah, we're still taking new patients and will be for the foreseeable future. I think probably the growth of our clinic will be to roughly 500 patients that we're providing primary care for. And at that point, it'll probably be up to another physician to step in who wants to do a similar practice and to start building their practice as well.
What are you hearing from patients?
Well, I think generally patients are just shocked. I mean, the first time they call the clinic and I answer the phone, they're like, wait, did I dial the wrong number? I didn't mean to call your personal number. No, this is the clinic number. It rings to my phone. And it's not always me that answers because I have two other people that answer the phone sometimes, but having that connection and that personal touch it is really important to patients, and they value it highly, you know, and especially the older patients. Now, we don't actually operate on a membership model for our patients over 65 because I've served so many patients over 65 over the years that I thought Medicare is a program that was designed for them. The government sort of promised them that program, and I feel like I should honor that. So patients over 65 we take care of just like we do our membership patients.
Right.
But we accept Medicare as our whole reimbursement, which sort of makes us a hybrid clinic in that sense. But for those patients especially, having a doctor who understands them, who knows the depth of their medical problems, who's been through some of their rougher medical times with them, it just enables us to take care of them better and to kind of keep them out of the vicious cycle of just adding more medicines to somebody's list and hoping they feel better somehow.
Right. What are some of the issues that you're seeing for us as a community when it comes to medical needs?
Well, I think just like any other community in any part of the country, we have a lot of people who just don't have the resources to afford insurance, and insurance is sort of a false hope when you have it and you still have to pay a lot of money out of pocket for things. So we see a lot of people that have insurance and can't afford to use it, and we also see a lot of people who, you know, of course, can't afford insurance and then don't qualify for government programs. So some of the patients will opt to go into a membership type situation with us because the cost is rather low, and other people.
Can we be frank and talk about the cost? Would you
Well, sure.
Okay, tell me about a membership cost.
For the youngest patients, you know, 18 to 35 or so, it's about $30 a month, and the price range goes up with age. There's a little discrimination there. Up to age 65, and the most expensive age category we have is $75 a month.
Oh, wow.
And so that's the cap, so to speak. So we're about the price of a cell phone contract, depending on how many bells and whistles you have. But we also make ourselves available to walk-in patients and patients that don't elect for membership. We have a cash price that's roughly half the price of a normal clinic. And that's partly to get people in the door, but partly also to have people have the opportunity to access care without breaking their bank. And we hope that people take advantage of that in such a way that they're able to stop major problems from becoming even bigger. Sometimes the sooner you get care, the sooner you learn more about your condition, the better you're able to manage it and stay out of the hospital.
Yeah, I've seen that, you know, before with someone who did not have insurance and waited.
Right.
Because it was just so difficult, you know, to think about the bills that would accumulate until it was almost, you know, dangerous, and they sought medical care. And
well, I spent a year between the time I was in Cuero and here working in rural emergency rooms, and it's an environment I was comfortable in because of the rural community that I worked in for so long. But more and more patients come in that have just simple problems, and sometimes it's not even a medical problem, it's more of a social problem, but they're utilizing the most expensive resource to try to handle their problems, and the inefficiency of our medical system is just on display.
Can we talk about that for a minute? Because that's really interesting. It's more of a social issue. Tell me a little bit about that.
Well, I do some teaching of residents, and I remind them occasionally that about half of family medicine is in a way psychiatry and actually social issues. When you really connect with your patients, when you get to know them, when you do house calls on them, you start to learn the challenges they really face, you know.
Now, are you doing house calls?
We do house calls, yeah. So this afternoon I have, I think, 6 patients on the schedule at clinic, and then we've got 2 house calls that follow that.
Really?
And those are, it's just reconnecting to the roots of medicine and those relationships. It's awesome to get out in the house and really see, you know, where people live.
Right.
And
See, I'm fascinated because in my years, almost 50, I only remember house calls as being something that was a time before my time.
Right.
And so you are really going back to that true relationship with patients where the doctor would come to you. I'm fascinated by this.
I think the medical office is a very sterile environment, and
Right.
for certain patients, it's just not a place they ever feel comfortable. So their blood pressures go higher. You know, they have to be dragged in by their ear, and it's not someplace that they feel comfortable,
Sure.
so they don't really feel comfortable following the advice we give sometimes. When we bring the care to their house, we're their guest, and
Right.
and we're basically coming to them, and that really helps them connect with us, I think, and understand what we're trying to help them understand
Sure.
about their health.
Did this kind of take you back to when you were, studying to become a doctor? What you loved most about medicine?
Well, it's exactly that, and that's where physicians are hitting such of a burnout right now. They're dealing with forms and pre-authorizations and telephone conversations with insurance companies, and the frustration amongst physicians is just palpable.
Right.
It's very palpable amongst patients too,
Absolutely.
and all of us need to take a step back and realize that what's really at stake there is the relationship between the patient and the doctor. And all of these other forces sort of pit the patient against the doctor in the end. And in the end, it really should be the doctor and the patient that are getting along the best. And that's the only way we could really work towards an effective healing relationship.
Politics aside, what was the change?
Well, one of my mentors from Quero, Dr. High, once said that his second least favorite day in his practice of medicine was the day that Medicare came into existence in 1965. And of course, I'm taking Medicare in my practice, but when the government started working in the day-to-day workings of medicine, it created a bureaucracy. And one thing physicians don't generally care for is bureaucracy that tells
Right.
them what to do or how
Sure.
to do it. And patients don't like those limitations either, but every time we sign away a contract to an insurance company to provide us some benefit, the insurance company considers that benefit a loss to them.
Right.
And that becomes an expense and hits their profit margin. And I'm not saying that insurance companies aren't there for a purpose, because I think for catastrophic expenses, we need that
Right.
protection.
Right. And even on your website, it does say very clearly, we absolutely recommend that you have insurance
Correct.
for the big stuff.
But perhaps the government's not the best organization to provide that. And when we made it compulsory that everybody get insurance a few years ago, it seemed like a good idea. Everybody will have coverage now. But what happened very quickly is the rates of insurance went so high that even the people who afforded them initially couldn't afford to re-up.
Right.
And so that became sort of an ineffective fix to the problem. I think really when you take insurance and bureaucracy out of primary care and you value the time that a physician can spend with a patient, we can keep people out of the hospital. We can keep people out of the cath lab and the operative suite. We can take some of these chronic disease processes that lead patients to dialysis and things, and we can actually make a difference in it before they get to the expensive care. Traditionally, Medicare valued the procedure much more than they did the time that a physician can spend with a patient. And that's why the
I
medical
see.
system turned into a specialty care
I
heavy
gotcha.
system.
Right. See
I
that?
can make more taking a cataract out in 3 minutes than I can for counseling a patient on smoking cessation. And
Right.
which one makes a big difference in their life? Well, both. But that time is invaluable to patients, and unfortunately, it's not heavily valued in our current medical system. So doctors are almost penalized for spending more time with patients, unless you go to a system like this.
Right. Right.
And this allows patients as much time as they need.
I love that. What are some of the primary questions that you get, or most frequently asked questions?
Well, I think the most common in the front desk would be the best person to ask. My wife works the front desk usually, and I think the most common question is, do you accept my insurance?
Right.
And our question is, or our answer to that is, if you're on Medicare, yes.
Right.
And our big answer to that is that we take patients regardless of what insurance you have.
Right.
We don't bill insurance, we bill the patient directly, but our costs, in many cases per visit, is less than the out-of-pocket copay for a regular office visit. So I think in that sense, we're able to bring affordable care, and where we really try to help even more is to be available. One of the biggest frustrations of trying to see 35 patients a day in my old life was that the patients who were the sickest and who called in couldn't be seen for 2 or 3 days. And that means they wind up in the hospital a lot of the time. The patients who couldn't get out of the house, doctor, I was too sick to come see you. those are the patients that we need to get out there and see. And
Right.
that's what in this practice we're trying to do, is get out there and see them, not next week, but hopefully the same
Right.
day.
And you mean literally go
mean
out to
literally.
their home to see them.
So our hours that are posted on our clinic are sort of confusing, because some mornings we're there, some afternoons, and then
Right.
Friday we're there most of the day. But what we generally tell our patients is those are our posted hours.
Sure.
For our patients, we're
Right,
basically
for
open all the
members.
time.
Right.
And so there's not many Saturdays that I don't meet one or two patients up at the clinic. And it takes me a couple of minutes to get to clinic, and there's always something else I'm doing in town at the time. And for patients, it basically means they don't have to go to the emergency room. They don't have to go to urgent care. And even with insurance, urgent care can sometimes be $250 or more. And that's expensive care.
Now, I want to ask you what I think will probably be coming from some naivety here on my part, but does, by eliminating the insurance in any way, make you less responsible for problems that might arise? Or is it by eliminating insurance in any way take from the responsibility that a doctor has to their patients?
Well, I think insurance companies are trying to bring in quality measures right now,
Right.
and measures that that rate doctors on how well they do with especially preventative care, because after
Right.
all, when you're an insurance company, your biggest concern is to minimize expenses.
Right.
We're actually taking that problem head on. We're not doing that because we're incentivized by the insurance company. We're doing that because we're incentivized by the people we're taking care of.
Right.
And we aren't always able to make a world of difference in each patient's life, because there's many factors that are involved. But by digging in on some of the deeper issues, we're usually able to gain what I call more traction with the patient, and help them see a better way.
Right.
Sometimes that's through healthier eating, sometimes it's through healthier exercise, and sometimes it's eliminating habits that are getting them in trouble. But we're directly taking responsibility for that, and it's frankly, for family medicine, it's what we're trained to do. It's just that it's not valued
Right.
in the traditional reimbursement system. For us directly with our patient, it is the value. The healthier my patients are, the fewer calls I'm going to get in the middle of the night.
I see. What about for businesses who might employ 20, 30, 100, 200 people? Is this a service that businesses can work with you, or do you really?
It is actually, when you boil the costs down for especially younger employees to as low as it can go, in between $30 and $75 a month, basically, for businesses would mean that their employees would have access to medical care even after hours. And for an employee, that sometimes means that their employees aren't missing as many days sick.
Right.
But we hope what it means is generally their employees are going to be healthier. Their chronic medical problems that sometimes wind them up in the hospital, such as diabetes, would be better controlled. And
Because you just get better quality care.
well, we're reaching out and we're communicating. I mean, in a normal diabetic patient, they would follow up every 3 months. Ideally, they would turn the turnstile at the clinic and
Right.
charge a visit. But we try to make adjustments with our diabetics every week or two. We have them text us some sugars, and we'll adjust insulin and other medications. And we try to stay on top of it much more closely, because the longer you wait to get it under control, the more things spiral out of control. So what many businesses have realized when they get access to primary care for their employees is that their employees are sick less, they're out less, and even their major medical expenses actually go down quite a bit. And insurance companies eventually reward that with lower premiums. And when I say lower premiums, sometimes that just means the premiums don't go up as much
I
as
see.
they would have, but because premiums are all going up.
Right.
But
How
we
do-
think that's a way that primary care can really step in and fix, even nationwide, a lot of the problems that we're having with expensive care.
Are insurance companies scared of this movement?
I don't know that they're scared. They aren't really scared of anything.
Right.
They're scared of competition, I think.
Sure.
But it's interesting, there's a lot of movement towards cost-sharing plans right now, such as Medicare, and some of them are Christian-based and some of them aren't. Those are programs that are designed to basically cover catastrophic events. Until you've spent $5,000, they
Right.
don't kick in. and that's an example. But that type of a cost-sharing plan can be very affordable, and it can be a great substitute for major medical insurance. That plan pairs very well with a plan like our membership, because your primary care is sort of a fixed cost per month. It's only that out of pocket per year, and then the catastrophic is still covered with the cost sharing. So some of our patients have opted for that. That's actually how I'm covered right now with my family as well. So it's a nice combination, and it keeps the overall healthcare expenses, if you're healthy, down.
And do you see, and you're seeing this trend now throughout the United States, just quadrupling over the last few years, this type of care?
Generally speaking, and this movement started up in the Pacific Northwest with one physician, and then just has mushroomed. And now there's conferences several times a year, including from the Academy of Family Medicine, on how to do this kind of practice. And at first, doctors kind of step in, like putting their toe in the pool, and it's like, this can't possibly work, it can't possibly work. Then they talk to more and more people, and the physicians who do this are generally so passionate about how well it's working for them and how well it's working for their patients, that eventually a good number of those physicians have jumped in. And I've even met a couple of doctors who are just out of training and are stepping into this practice as their first practice. And that's a very brave and a very bold way to step into practice, because it involves running a business and the risk of failure. But the first 18 months for most practices seems to be the key, and almost every practice fills up in that time. And it's all word of mouth.
Right.
Major advertising expenses are not usually a part of these practices. It's happy and satisfied patients that are shaking their head trying to understand how it is that they call, and their doctor answers.
Right.
They tell their friends, and next thing you know, here they come.
Well, the big thing too is the wait time, I think, and the wait time, and feeling like you've gotten real time with your doctor. This is going to be huge.
Real and quality time matters, and availability when you need your doctor is a big deal. And patients really value that. And many people that are busy in their life, time is money, and if they have to go wait an hour and a half in an office with other people that are coughing, they just won't do it.
Right.
So our waiting room is sort of a reception area. It's not terribly busy most of the time. Most of the patients come right back to rooms, and we try to take care of them. And
where are you located?
Well, we're sort of on the pharmacy corner in town here. It's the corner airline in Navarro, so we're sort of across the street from CVS, diagonal from Walgreens, and literally right a few paces away from Harding and Parker.
Right, Harding and Parker. Right.
Sort of our old throwback pharmacy.
Well, this has been lovely. I want to leave you with one other question, which is, so this is really, as I hear it, as I'm feeling it, is that it's a movement. So where do you think medicine, well, before I ask that, I will say this. I have a friend who is a physician who said, if your children now are truly interested in medicine, it will have to be about the love of people, because otherwise they won't make a living. And I found that shocking. That was probably five years ago, that it's hard for doctors, to make a living. But for the doctors that truly love patients, this is an amazing career to be in. And so I see this as a way, as the type of medical family center that you have, as a way for that to, to happen, that doctors can get back to their patients and also still make a living, and it not be so frustrating. And like you said, the burnout, because the burnout is incredible.
Right.
I feel, because with friends that are physicians or married to physicians.
Burned out doctors, grumpy doctors, they're not good doctors. It's a time when it's very hard to serve your patients well, when you're so frustrated. So, your passion is really what gets you into medicine, hopefully, and the types of people that we're trying to bring into medicine young are the young people that are passionate about taking care of other people. And no matter what you do in your career, no matter what you do in life, if you're not connected to your passion, then you're not going to find much satisfaction. So I think it'll still be possible for physicians to make a very comfortable living. I think when you see poverty in the way that it is in our country in some places, I think it would be silly for physicians to say, well, we need more. you don't need more money, you really need more passion. You need more
Right.
passion for your patients, more passion to take care of them in the way they want to. And my connection to medicine from the beginning was that passion for helping people, for taking care of people, for communicating well and sitting down and listening to people, allowing them to share their thoughts, their concerns, their fears. If we don't understand those things, not only are we not serving our patient, but we're not really living up to our oath of the practice of medicine. We're supposed to do no harm, and sometimes when we're trying to get patients in and out of a clinic fast, that's what we're doing. We're
Right.
prescribing medications that are unnecessary, treatments and tests that are unnecessary, and as time goes on, we learn more and more that those things are harmful actually to patients more than helpful.
Right.
So I think that connection to the root of medicine, that root of the relationship is what has the potential to save medicine. Other countries have had different approaches, and our country will have a different approach, which is a combination of capitalism, free market, and government.
Right.
But at some point, it's got to boil down to that relationship. And my hope and my prayer for medicine is that the people that are entering medicine still have that as their primary focus.
Passion. Thank you so much, Dr.
Well, thank
McLeod,
you.
for coming and visiting.
I appreciate what you do.
And taking some time to address some of those questions. And then also, too, thank you for being a part of the CASA Backpack Drive.
Right.
I do appreciate that. Ladies and gentlemen, this was a wonderful opportunity to get to know Dr. McLeod, who was at the Victoria Family Medical Center. Wonderful.
Very
Thank
good.
you so much again for being
Thank
a part
you,
of
Indra.
Southbridge Street Live.
Okay.
And thank you all so much for watching.